So the most basic and understandable definition of what knee arthritis is its wear and tear of the knee joint itself. So knee pain or a knee sprain or strain is an acute event where you may tweak the knee a little bit funny and the soft tissues around the knee get injured. Now this heals with time, but it's going to take rest, ice, anti-inflammatory medications such as Advil or Aleve. And the difference between that and knee arthritis is developing over time. The cartilage starts to wear away on the thigh bone or the femur and the shin bone, the tibia. And when those two surfaces are rubbing together with the cartilage missing, that's where you get that the term out in the general public of the bone-on-bone arthritis. The best thing is maintain a healthy, active lifestyle, low impact aerobic exercises, maintain a good diet. And also the other thing I want to emphasize is that when you are overweight, for every 1 pound that you're overweight, the knee joint itself sees 3 to 4 times that in terms of forces. So if you think about it, if you're 10 pounds overweight, your knee joint is actually seeing 40 pounds in excess of force across it. So that contributes to the early wear and tear for sure. So say you've been told you have knee arthritis itself, what can you do to manage it? And a lot of times your family doctor or your orthopedic surgeon or sports medicine doctor is going to talk to you about this stuff. Number one is physical therapy. The stronger you make your muscles around the knee joint, the stronger those are and the more toned those are, that takes that force off of the knee joint. So your knee's going to be happier if your quads and hamstrings are stronger. Beyond physical therapy, injections. The injections help calm the knee down, and a lot of times what your physician will do is you can get the injection and then work with physical therapy, and the two are worked in tandem with one another so you can better participate in those physical therapy exercises. So if you come in, you have knee pain, you have knee arthritis, you get the injection, you can do the exercises more effectively. Other situations, and these can be discussed with your doctor as well, is bracing can often be effective, and this gets into the specific type and how far advanced your arthritis is. There are some braces that are specially designed where it can push the knee over to a certain position to offload the bone-on-bone part of the knee, so to speak, and that can actually provide a lot of relief. So the meniscus tear itself may just be an underlying manifestation of the actual knee arthritis that's going on. So it's important to look at the big picture when you have the meniscus tear. The other element I want to highlight about a meniscus tear is you have an athlete that comes in, maybe they're a football player, they had an acute event, a knee injury, and they tore their meniscus. In that situation, it's an otherwise young and healthy knee joint, so you want to save that meniscus or do all operative measures to try to repair that meniscus, because the healthier your meniscus is, that helps also delay the onset of arthritis in your knee. The surgeon is going to go in and cut out the arthritic portions of the bone in the knee joint and replace it with sophisticated metal and plastic. So in effect, what you've done is you've cut out the arthritic parts of the knee joint itself that are rubbing and giving that pain with the bone-on-bone sensation, and you're replacing it with artificial surfaces. Now, there are different types of knee replacements, and again, this gets into a discussion that you can have with your surgeon, is in some situations, when there is bad arthritis in only one compartment of the knee, you can do a partial knee replacement. So you may have heard that being talked about before. This is also called a uni replacement, or uni knee replacement, is where the surgeon will only replace part of the knee joint. So following the successful knee replacement, most patients are back to what they want to do in terms of their activities of daily living within sometimes a few weeks, sometimes a little bit longer, 3 to 6 months sometimes. It all kind of depends on the degree of arthritic deformity and what the patient is going to specifically define for him or herself what is a baseline activity that they want to get back to, whether it's golfing, whether it's walking with the grandkids. There's various, there are different levels of returning to baseline activity that patients define for themselves, and really that comes down to a discussion that you have with your surgeon. The biggest thing I do say to my patients is that after that surgery, you will have a couple days of increased pain because of the surgery and the nature itself. Once you're in the hospital after the procedure, you'll work with physical therapists and they'll work on getting your range of motion back in the knee, because that's one of the major early goals that you have to hit. You have to get the knee range of motion back before you can do anything else, and they'll work with you on strengthening the muscles around the knee joint to help the knee recover. So it's a long and lengthy process. A lot of people they go home from the hospital maybe 1 to 2 days after the surgery, but it's several months of outpatient or home physical therapy after that as well. So following a successful total knee replacement, the vast majority of patients report excellent outcomes 10 to 20 years down the road following the knee replacement. So here at Penn Highlands, we have an established joint center that is working to provide that excellent comprehensive care for these patients in need. So here at Penn Highlands, this is what we specialize in: total joint replacements, total knee replacements. We're here to partner with you in this process, and we're here to get you back to what you want to do.